there are a lot of myths with injuries and rehabilitation post-injury and return to sport that I think really need to be addressed. In my experience, these myths are common, and the mental side of return to sport is often missed. So I feel that it's really important that athletes and all patients who have experienced a traumatic injury and possibly a surgery following that, and then trying to get back to their sport, that they understand the differences between true expectations and sort of preconceived ideas that may not be accurate. So that is part of why these myths exist. Usually athletes have seen the injury they have had by somebody else, or they have a teammate who's gone through it, they have a friend, or they've seen it on TV, or they've read about it, or they have an idea of what the injury means and what the recovery and rehab of that injury entails. And so that expectation that they have that it will be the same as somebody else can make a huge difference into how they recover and rehab themselves, because it's an individual process and it's not the same for any one person. And so the sooner you can sort of dispel that myth and show these athletes that everybody handles it differently, and you won't be the same as somebody else, and that the knee itself, if we're talking about a knee injury and a post-operative ACL reconstruction, that the knee itself will not feel the same as it did before. That is probably the number one common myth that I have found in my experience, is that athletes feel or think that their knee should be or will be exactly the same as it was once it's reconstructed, the ACL is reconstructed. So it may physically have the function that it needs after, but it feels different. And so the sooner you sort of dispel that myth and you educate a client that their knee is going to feel different, and that that's okay, and that doesn't necessarily mean that the function won't be still really good. I think that's really important to their long-term success and return to sport after a serious injury. There's also myths around athletes in particular regarding fear and pain. So athletes are perceived as being tougher, of being able to handle a lot of pain and push through it, and that they're brave and they can handle anything. And so this idea of what an athlete means is often a big part of what unfortunately ends up limiting their recovery, because they may be ashamed to speak about it, or don't want to admit that they have pain or post-operatively, or that they aren't recovering as quickly as they thought they would. They think they're strong and they're fit, and so therefore they can recover really quickly and they can handle anything, but it isn't always the case. And so again, those are some common myths that need to be dispelled, and so that the athlete can have a more realistic expectation of what the process is going to be like, and therefore not have as many ups and downs emotionally as they're going through the recovery process, because they know what to expect. And so that is a big part to finding a faster and more successful end to their rehab. Remembering that rehabilitation post-surgery is not just physical, is also important. So nobody really thinks about or speaks about, or I shouldn't say nobody, but not very many people address the mental side of an injury. And that is another sort of myth, is that rehab is just physical. When we really look at what an athlete needs to go through from the point of injury to post-injury, and then a surgery, post-surgery, all the rehab process, and then return to sport, there are so many mental aspects along that journey, in addition to the physical, which they need to do as well to perform well at the end. And so I would say that's another really common myth, is that rehabilitation is only physical. And the more we can talk about how there is a mental side to rehabilitation, and educate the athlete about that so that they're prepared for it, they understand it's normal, and then they can recover more quickly with coping mechanisms put in place, then ultimately they have the best chance to have the best outcome, and hopefully perform at a really high level at the end of it all.